Good evening, everyone. Welcome. Thank you for joining. All right, we got everybody coming in. This is exciting. Welcome, everyone. Thank you for joining. This is the innovative approach to offering GLP-1 and peptide therapies for healthcare professionals and wellness professionals. So, for those of you who are new to this space, new to my community, I am Dr. Jessica Chung. I'm a doctor of nursing practice and board certified family nurse practitioner. I'm the founder of JC Healthcare and Associates, which is a direct primary care practice based in Tampa, Florida, as well as the founder of the International Business Association for Nurses, where I help healthcare professionals build and scale compliant businesses. So, as you all know, this webinar is a hot topic. It is definitely a hot topic. We're talking about the future of healthcare, which is peptide therapies. So patients are asking about peptides, healthcare professionals, wellness professionals, everybody's asking about peptides. So the curiosity is real. There's a lot of questions. The demand is there, but there's some things and questions that people want cleared up and they want answered. So people want to know, what exactly are peptides? How can peptides be accessed the right way and compliantly? And how can this be done in a way that is compliant and doesn't require you to build an entire medical practice or business from scratch? So I know a lot of you here are wellness and healthcare professionals. Some of you may not be licensed to prescribe medication, but there's still an opportunity for you to offer access to peptide therapies to people that you know, your clients, your patients, even friends and family members. So that's what tonight is about. So we're not going to be talking about hype or trends or how to get them behind the scene. We're talking about compliance. We're talking about upfront right way that you can offer access to GLP-1s and peptide therapies. So this is about understanding how this space is evolving and how healthcare and wellness professionals can participate responsibly. So I'm excited to introduce our speaker that will present this information and teach us all more about not just peptides, but the actual business opportunity. So we have Lori Werner. Lori is a menopause coach and the founder of Medical Marketing Wiz. And I've been working closely with Lori. Lori has been in this space for actually not a long time. She's been in this space with her clients, but as far as this introduction of this space and this opportunity, Lori actually jumped on the opportunity and she reached out to me and I jumped on the opportunity. So I'm excited for her to get you all to jump on this opportunity. So I'll tell you guys a little bit more about Lori and then I'm going to turn it over to her. So as I mentioned, she's the founder of Medical Marketing Wiz, which is one of the leading marketing agencies in North America, specializing in women's health, anti-aging, and longevity medicine. She is also the senior manager and brand partner at EllieMD, where she works closely with providers who are expanding into cutting edge peptide and longevity solutions. Lori has over 15 years of experience in medical sales and marketing leadership. She has worked with hundreds of physicians, nurse practitioners, chiropractors across the United States who are focused on building profitable anti-aging and longevity practices. She is known for helping providers grow authentically, connecting them with the right patients while building credibility and long-term revenue. Today, Lori will be sharing how to incorporate peptides into your practice, into your clinic, into your coaching, your counseling, whatever it is that you do with your patients and clients. So along with that, she's going to share practical marketing strategies to help you generate more patients and clients and increase your revenue. Thank you so much, Lori, for joining us today.
Jessica Chung, Dr. Chung, that was amazing. And I am so blessed to be part of your group. So, Dr. Chung and I have known each other probably 5 years or so, more on the marketing side of things. So, I've done a couple of webinars with her and her group. And as she mentioned, I work with so many physicians, chiropractors, nurses, and even health coaches across the country. And I'm very picky about who I align myself with, right? Because my main business is my marketing company. And I've worked very hard over 10 years to build the reputation of this company. And of course, anybody that I align myself with, I want to make sure any company I align myself with, I want to make sure is something that I can put my name behind. And so when I personally learned about the opportunity to be able to bring peptides into clinics that are offering peptides, but kind of have the headache of, you know, gosh, I got to find the pharmacy and I've got to buy the peptides. And then I'm not really sure if the patient's going to come back. And then the pharmacy isn't offering a certain peptide, and then they have to go find another pharmacy. So that's kind of one side of the coin. And then the other side of the coin are we work with a lot of, for example, medical spas or chiropractors or naturopathic physicians who do not have prescribing privileges. And so it's become more difficult for them to really provide a comprehensive wellness solution without having access to peptides. So when I learned about this, I personally also wanted peptides for myself, and I know how hard it is sometimes to jump through hoops to be able to get them. I saw the business opportunity and I thought, you know what, I'm going to do this for myself and I'm going to let my clients know. And certainly what I'm going to go over today is not for everybody, right? This today is for you to just learn a little bit more about it. If this is something that you feel like would align with your practice, I think it's a great opportunity. If not, it's always something that you can kind of have in your back pocket and be aware of. Because as Dr. Chung mentioned, at the end of the day, patients are looking for these peptides. My college son comes home from college and he's like, Mom, I can't believe you know about peptides. And it's like all over his TikTok, even. And so, what we don't want is our patients to be going to Amazon or these black market, gray market places to get peptides, because I can tell you many of them are doing that. And these are the people that are getting sick. And so this is a very accelerating market. So from a marketing standpoint as well, I think it at the end of the day, right, you want to keep your clients and your patients coming back to you. And so if you have a way to be able to offer these things, you're really tapping into still what is very much the beginning of what is exciting for me, just how the shift in medicine now has become so much more prevention. And I think that's going to continue. So, anti-aging longevity medicine is something that it's the future of healthcare, thank goodness. And it's projected to actually exceed 150 to 200 billion by 2023. And we're not just talking about GLP-1s, we're talking about other longevity peptides, which we'll share with you today. And so, what we're going to talk about again, I'm not going to go through all of the peptides because I think most of you here are your clinicians, your wellness providers, and specialists in the health and wellness space. You know what many of these peptides are, but this is going to be a way to be able to add these services into your clinic without having any overhead, any liability, and a way to capitalize on revenue. And I'll just mention real quick, sometimes I'll talk to clinics that are offering peptides and I kind of ask them, okay, walk me through what your process is right now. And they're talking about having to buy the peptides, and then the patients have to come in and they're answering the patient's questions, and they're, answering, adjusting doses. And I say, at the end of the day, how much are you actually making on this? And they're like, you know what, Lori, I don't really know. I haven't really put a number to it. And so when you think about a way to be able to offer these without overhead liability, and having to have a medical director, for example, even if you are a prescriber, it may be a good way to kind of take some of that headache off of your plate and allow you to still be able to offer these in a compliant way. So, as we mentioned again, doing yourself. It is high overhead. Many times you need to have a medical director. Maybe that medical director isn't there all the time. You've got to think about DEA, compliance, insurance, and this platform that I'll share with you eliminates all of this overhead. The other thing that is big is obviously patients do want telehealth. I know for me as a busy professional, when I go to my functional medicine doctor, I can now go get my labs, come back, do a Zoom meeting with my functional medicine doctor. They can go over all of my results with me, and I can do this on my lunch hour. So it saves me a lot of time. And again, this is something that is not going away, being able to capitalize on that telehealth. So if you're not currently offering telehealth, this is an opportunity for you to be able to partner with a telehealth platform that will allow you to expand to some of those telehealth services. So the company is called EllieMD, and it really is a telemedicine, concierge telemedicine company. The beauty of it is it actually also is licensed in all 50 states. So there are functional medicine slash longevity medicine certified providers that are part of LEMD that are in all 50 states in the United States. So Dr. Chung and I were talking briefly about, she's in Florida, I'm from Michigan. Half of the year, half of my state goes to her state because they want to get out of the cold. And the thing that's nice about this is if you are a provider that maybe isn't licensed in both states and you offer peptides, now you're able to continue care for the patient as they travel south for the winter months, for example. The other nice thing about this is you actually keep the client relationship. So the LEMD providers, and I'll walk you through a little bit about how it works. They're not here to meddle in with whatever thing you have going on with your patients or your clients. So if you're doing a gut health protocol with them, if you're handling their hormones, all of those sort of things stay with you and your patient relationship. They don't actually meet with the patient. They're actually looking at a health assessment that the patient completes. They're determining if this patient is safe or not to actually order the specific peptide that was recommended to them. And they're not really going to meddle in your patient care. So a lot of the providers that I work with really like that. Because again, at the end of the day, they're your patient and you want to keep them as your patient. The commission structure for LEMD, it's a sliding scale between 20 and 40% of a commission that you make based on the point value associated with the various peptides. And I'll walk you through that in a minute. They also have a bunch of other little bonuses and fun things like business retreats and swag and things like that that you can earn as well. So this is the commission structure. Each peptide has a point value associated with it, because technically you cannot make a commission on a prescription. So there is a point value which we call PV that is associated with each peptide. And again, you start at a 20% commission, but very quickly you can get up to a 40% commission. Just to give you an example, a GLP-1 GIP has about 220 points associated with it. So even with just 2 patients, you're close to the 25% commission mark. In addition to that, LEMD does have a referral program. So if you have a health coach that's a friend of yours, or maybe a nurse that you went to nursing school with, or another doctor that you know that you want to tell about this peptide telehealth platform, if they do sign up as a brand partner, you do make a small override on all of the referrals that come in through them. So it's just a nice little kind of thank you. I know for me, again, I refer people to tons of things that I like, and I don't ever get any sort of commission for it. So it's a nice little thank you for referring other people to the business. A little bit about the actual peptides themselves and where did these things come from and where is the pharmacy and all of that. So the company, again, as I mentioned, does not operate in the gray market or the research grade or black market peptides, which is important to me. And, for my own health and obviously to any clinician that I end up referring to LEMD. The pharmacy is called Clover X Pharmacy. It's actually located in Texas. And at the end, I'll put the link to this if you want to take a look at it in the chat. It's an FDA inspected facility, and they do have all FDA inspected ingredient suppliers. It is a closed supply chain. So, and it's all compounded here in the United States. They do independent lab testing. They have triple and quadruple filtration for contaminants, and the pharmacy is certified by the National Association of the Boards of Pharmacy, which is actually voluntary. So, in terms of integrity and safety, it's extremely important, for you to know that they've got, all of that stuff in place. To talk a little bit about the patient journey, and then I'll touch on some of the peptides that they offer. Essentially, the patient journey is really simple. So you, as a brand partner, get a link that EllieMD provides you. So elliemd.com/, mine is midlife. And so your patients would scan your QR code, or this is also something that we at Medical Marketing Wiz can link on your own website, your regular website. The patient will go on and sign up for a free account. There's no memberships or anything like that required. They will pick which peptides that they want. Now, of course, this can be based on your recommendation. You just cannot, you sort of have to, if you are a prescriber, you have to take your prescriber hat off, because remember, the liability and the approval of the prescriptions lands with Ellie. That's how they remain taking the liability and all of the overhead and everything for you. So in that scenario, you might, maybe I'm your patient and I start talking about, how I'm menopausal and I just have this 15 stubborn pounds I can't get rid of. I just don't have the same energy and my libido's down. And you might say, you know what, Lori, there are a couple of peptides that align closely with some of the symptoms that you're telling me. You can go on our website, go ahead and take a look at NAD, take a look at microdosing of tirzepatide, and you also might want to check out the BPC or the PT-141. So you're not prescribing me the peptides. You're simply kind of saying, hey, this is what most closely aligns with the symptoms that you're describing. I'm going to go on and I'm going to put them in my cart. I have to complete a HIPAA protected health assessment form. So this is going to ask me, and each peptide kind of has different questions that it asks, because obviously, there's different qualifications based on the peptide. But it's going to ask me, obviously, my height and weight and what medications that I'm currently taking. Do I have a history of cancer? Those sort of basic questions. It will ask me if I've seen a doctor in the last 3 years and if I've had my labs done in the last 3 years. They don't technically require labs, but certainly if you've done labs or you want them to get their labs done, you definitely can do that. The patient can upload those labs if they want, but essentially they're just wanting to make sure that that patient has been seen by a doctor in the last couple of years. The LEMD doctors in all 50 states, depending on what state the patient is in, is going to make an appointment with that person's file. So they're not actually going to get on Zoom. They're not going to tell the patient, oh, I think you should actually take this other peptide. They're only looking at the peptides that they put in their cart, and they're determining, is it safe based on the HIPAA protected health form for this patient to get this peptide. Once that is approved, which usually is within 24 hours, if for some reason there's a contraindication, the patient will be notified and their money is refunded. But most of the time, again, these are amino acid chains. Generally, most people are approved. The peptides are shipped directly to the patient. They don't have to reconstitute. They're already mixed. It comes with the alcohol wipes, the syringes, the instruction booklet. They actually get this cute little water bottle that comes with it. And then the patient also has 24/7 direct support through the portal to ask any questions. If they have any issues, they can message the LEMD physician and nurse line as many times as they want. So any questions that come up, again, they can address that directly with the patient. And simply, you are just sharing, earning, growing. LEMD does all the heavy lifting for you. Your job really is to raise awareness, and LEMD manages the compliance and the prescriptions, and you actually get paid every single week. So, touching quickly just on the various peptides, and I will tell you, we're recording this now in February. This list may get longer. They're constantly adding new products every single month. They do have obviously the GLP-1s. The GLP-1s are available in both an injection as well as oral drops. The injection is obviously the most popular, and it's what most providers will recommend just due to efficacy. But people are completely, totally, afraid of needles. The oral drops are a great option, and those are actually also a once weekly oral dose. They also are customized for every single patient based on that patient's BMI, and the patient can choose their additives. So they can choose the B12, the L-carnitine, or glycine. And again, this also helps to kind of get around some of the issues with like the brand name products. But what's really nice is the patient is getting the exact dose for their specific BMI. So this is available in both a microdose as well as weight loss dosing. The weight loss dosing, and they actually just dropped the price on this to even make it more competitive. So the weight loss dosing starts at $299 a month. The microdosing starts at $239 per month. The weight loss is on a sliding scale. So most of the people do tirzepatide, I feel like. And pricing wise, it's very comparable. So it does go up depending on the dosage that they're on. But again, extremely affordable, especially compared to if they took, the brand name and then all of a sudden they get kicked off the insurance and they're paying, $1,000 to $1,500 a month for some of the brand names. So the pricing is actually, I feel, very fair and comparable. And again, it's not going to be the lowest price, but at the same time, we're not dealing with gray market and research grade peptides. We're dealing with pharmaceutical grade peptides. They do also have a GLP-1 support shake. I actually had this for the very first time today as a snack, and it was actually really good. So that's something that's important, especially because we know a lot of people that are on GLP-1s lack the right amount of protein. So we want to make sure to maintain muscle mass. So they do offer that. In the longevity category, they do have not only Samoralin in both injection and oral tablets, they have Tesamorelin and Ipamorelin. They also, this one is new in the last few months, Thymosin Alpha 1. So that one is great for immune support. So this one, I personally have not tried this one, but I'm excited to. I do take, just as a side, I personally have been on the microdosing of the tirzepatide since last January. And I'm a menopausal woman, so I'm definitely the woman that had the whole, where did this weight come from? I've never had a weight problem my entire life, and I've been extremely happy with it. NAD, obviously, a super popular one. So they offer NAD, glutathione, as well as B12. This is another one that is extremely popular, I think, with old and young alike, is the BPC 157 TB 500. I personally have taken this for my lovely menopausal frozen shoulder. So I've done PT. I actually went to a physician. I got a prolotherapy treatment done to kind of help with my frozen shoulder. And then I did the BPC 157. Amazing results. So really good for joint healing. It also is great for gut health. So they do have both an injection as well as an oral formulation of the BPC 157 TB 500. Methylene blue, again, this is a new one that they've just gotten in the last couple of months. And then in sexual health, they have PT 141 as well as the Thrill Pill, which is a PT 141 with some other fun things. I did actually try this once with my husband, so I had to try it. So I'll leave that at that, where you can try it and see how it works. And then skincare. So this is also huge, especially for anybody that is doing anti-aging and longevity, right? We want to think about our skin health. They have GHKCU. I do personally also take this one. This has been great as well because I've been on the microdose tirzepatide with the hair loss. So it helps with hair, it helps with skin rejuvenation and wound healing. And they also have a skin formulation of this as well. So this one again is a compounded, and it's $149, I think, for 2 months. So pretty affordable as far as that goes. Anything you want to add, Dr. Chung? I know you hopped on. I know I wasn't sure if you wanted to add anything just on the.
I'm getting feedback on your let's just your experimental peptide with your husband.
Oh, okay. Yeah, sorry. I'm telling you all
That's okay.
my dirty secrets here.
I so there's a lot of questions coming in, and somebody was actually asking about ones that you covered. Someone
Okay.
um so
Yep.
at the towards the end, not the very end, but towards the end of this, we're going to share a link so you can actually go on that link. You can
Yeah.
and we'll explain how that process works because you actually want to see the process as if you are one of your clients, patients, family members, friends
Yeah.
actually ordering the peptides. So you'll be able to do that. And then on that link, you'll be able to see what all the peptides are available through EllieMD, what they're good for as well. And like Lori said, EllieMD is adding peptides continuously. And so the list that you see right now is not all of them, and they
Yep.
are continuing to add them. And I just wanted to also mention for those of you, like Lori mentioned briefly, that are not prescribers. You're not a prescriber. Maybe you're a chiropractor. Maybe you're an esthetician. Maybe you're a hair loss specialist. Maybe you're a pharmacist. Maybe you're a mental health professional. This is also supports whatever you do. LEMD is the place where you would refer your
Yes.
clients, your patients, whoever they are. So you're referring them. You're not having to all of a sudden become this expert in peptides. No,
Great.
you might have a client and they're dealing with something. I'll just use my mental health professionals as an example. And you know that maybe something can help them with boosting their energy level, maybe dealing with depression. And you're like, you know what? I want you to take a look. I'm going to send you a link. Take a look to see, peptide therapies are becoming very helpful for a lot of different things, not just the physical. We're
Mhm.
talking about the whole body, so mental, physical, all of that. So definitely look at it that way. It's not like you're trying to, become this expert and you have to know about the peptides. Really, you just have to know that, it worked for you and you're just referring someone, hey, give this a try, see how it works for you. And so I just wanted to add that in.
Yeah, that's a great point. So 30% of the brand partners at Ellie are clinicians, 70% are not clinicians. So a lot of exactly what you said, a lot of it are people that have been on peptides themselves, and you become almost a walking, talking billboard. I mean, you go to your high school reunion, like, what in the heck has Lori been doing? Tell me what your secret is. And it's like, hey, I'm doing all the things. I'm exercising, I'm eating right, I'm getting a good amount of water, I'm getting my 10,000 steps. But you get to a certain age, and a lot of times that stuff is not enough. And there's multiple studies that show that, um, microdosing GLP-1s not only helps with, sleep apnea, it helps with systemic inflammation, it's protective, cardioprotective, even addictions. Like for me, myself, I have no desire to drink wine or anything, where I would almost like if I had a rough day at work, it was like, I need to unwind with a glass of wine. Well, that's a lot of calories that adds up. So there's a lot of opportunities for this business. And I'll share just really quick. And this is one scenario, right? There's a bazillion different scenarios, but this is if you had 10 patients per month on semaglutide at the point value that I mentioned. At the end of 12 months, it's an extra $68,000. Like to me, that would help pay for my couple of kids' college bills. I got two in college right now. That would be amazing, to help out with that. And then obviously it goes up from there depending on, the scope of your network and, how many people you want to help. But the sky is really the limit in terms of being able to really generate a nice amount of revenue and help a lot of people at the end of the day. That's what it's about. They do also offer some great social media tools. There are hundreds of social media posts that are already done that you can plug into your existing social media. They have email marketing templates that you can drag and drop into your Constant Contact or MailChimp or, just send out via Gmail to your friends, family, clients, etc. And then LEMD is very big. So it's actually a woman-owned company. Hani Saguri is the CEO. She's a gerontologist and longevity expert, and she's very focused on patient education, which again is very important to me. I think at the end of the day, he or she who is the best at educating their community is authentically the best at marketing, and they're very invested in patient education. So every single week, they're hosting different webinars that you can tap into and send to your patients in your monthly newsletter, have them on your social media to help educate patients about the various peptides. And then also, it looks like I have another flyer here that didn't show up, but weight loss and wellness events. So the nice thing about partnering with Dr. Chung is you also get access to me and my team at Medical Marketing Wiz. So we're here to help you be successful and give you some of these ideas. So again, whether you're a clinician or you own a gym or you're a mental health professional or a health coach, these sort of weight loss and wellness events can be a great opportunity. And so, as Dr. Chung mentioned, I'm going to kind of go through how to get started. You'll see this QR code a couple of times, but essentially, the beauty of this is the cost to become a brand partner is $79. It's a one-time $79 fee. There's no hidden costs or anything like that. You pay that one time. And then the only recurring fee that you have is an $8 a month fee where they give you access to your lead tracking system and kind of where your payments come through. And they also give you a website. So they actually give you a beautiful LEMD website. It's lemd.com forward slash, like Dr. Chung's is lemd.com forward slash Dr. Jessica Chung. And you can go to that, you can order the peptides. If you scan this code, it'll actually go directly to the enrollment to sign up as a brand partner. So I'll come back to that in a minute. So essentially, once you become a brand partner, this is where I was saying you'll get access to this little back office where you can log in. You're going to pick your name. So mine is midlife. Dr. Chung's is Dr. Jessica Chung. So you can have it really whatever you want it to be. And this is going to be the page where people can go and actually order the peptides from you. In addition to that, I'm actually going to skip a slide here for a second and I'll come back, is we can connect this to your existing website. So if you want to have your regular website and you want to have it up in the menu, you could have a button, you could have a dedicated peptide page that we can help you with that will link to that order page that Ellie gives you. And then this, as we mentioned, is important for you if you do sign up to be a brand partner to place an order from yourself. And that's just, for two reasons. Number one, you want to get to know what these peptides are yourself, but also it's important for you to kind of understand that patient journey. What does that health assessment actually look like? How quickly do you get the products? What is this patient portal like? So it gives you a good chance to just kind of go in and place an order and understand that whole patient process. And then lastly, and this is one of the things that I absolutely love, is we have a very fast way to launch you. So let's say you sign up to be a brand partner today. We every other Wednesday have a live webinar, and it's going to be Wednesdays. We may end up changing it to do it Tuesdays if we feel like more people want a different day of the week. But every other week, there's going to be a webinar called Longevity Leaders. This webinar is a patient education webinar to teach patients what is a peptide and a little bit of the health benefits. New brand partners will come on and I'm kind of the MC of the webinar, but a new brand partner can come on for a couple of minutes, introduce themselves, talk maybe a little bit about if they have experience with peptides themselves and their own transformation, or just a little bit about their practice or their wellness business and how they're excited to be able to bring these peptides to their patients. So, as Dr. Chung mentioned, you don't really have to know anything about peptides to be able to start and launch right away because you're going to be able to piggyback on these webinars that we do every other week. And like I said, we can launch you, you can sign up today, and the very next webinar that we do in a couple of weeks, you'll be able to get on and be a spotlight. And I can tell you it is amazing how many of your patients will want, and clients and friends and family want to come and support you and listen to you on the webinar. So it's a great way to just be able to launch and not feel like you have to be an expert right away. So I wanted to put this back up real quick, just for you guys to go on and check it out, learn a little bit more about EllieMD. And again, 79 bucks. I mean, I work with many providers that have a lot of medical devices and they're spending 150, $200,000 on these medical devices, and they've got big dust collectors in their office. This is such a great way for you to be able to, without a huge, capital outlay, to be able to bring peptides into your clinic and into your business. And like I said, help a lot of people as well as, helping your bottom line for your business. So I will leave this up. We have a lot of questions. So let me see here what we got. Um,
You could start from the top, Laura, because you could read the questions and then you can add
okay.
the answers.
Okay, so one person said, "What are peptides and what does it do?" So, I didn't really want to go deep into that today, but we can follow up with you and give you a recording of one of our patient webinars that we do, so you can sort of see the patient education side of peptides, and that might be a great thing for you to listen to. But essentially, they're amino acids that just tell your body to do what it used to do. So they're not actually like a pharmaceutical or a chemical that is altering or masking your symptom. It's actually telling your body to do the things that it used to do, whether it's regenerate new tissue, improve your metabolism, improve your gut health, all of that sort of stuff. So we can follow up with that eventually. Yes. Peptide will eventually be the future of precision medicine. You are absolutely correct. Um, so yes, we talked about the GLPs, we talked about Samoralin. Yep. So AOD 9604, that one is not available yet. But I would not be surprised if they didn't add it because again, they're offering peptides all the time. It is nationwide. I did have somebody ask me recently, is it available in Canada? Currently, it is not. So it's only in the United States and all 50 states. Are there white label options? So no, like the bottle actually says Clover on it. It doesn't even say LEMD. The bottle is from the pharmacy in Texas. So there's really no way to like put your own label on it. Unfortunately, but certainly you can have your website, have your own peptide page, and then you could just have the order button go to the Ellie page. Let's see, go back to some Moreland. Yes, I can go back to that one. Plant-based proteins are highly contaminated with other heavy metals. Yeah, so I am not going to pretend to be an expert in the formulation of their protein powder, but that's definitely something you can look at. Let's see. Results with oral versus injectable. So I know just, again, I'm not a clinician, and Dr. Chung may be able to speak on this more intelligently, but I know from the clinicians I work with, I have 77 different clinics and or wellness providers that I'm working with that are offering these peptides through Ellie. At the end of the day, the injectables are going to be better than oral, simply because with oral, you have to digest it. It has to go through the
Right.
liver. You're just going right straight into the bloodstream with the injectable. But again, it's nice they have the option because some people, the injection may be scary for them. Although it doesn't hurt at all. I'm a pin cushion right now. I'm on 4 different peptides. So I don't know if you have anything to add to that, Dr. Chung, just on the oral versus
I
the.
was just going to agree. If you anything oral, you're going through your, intestinal tract, the gut, slower absorption, whereas an injection is just, faster.
Oh,
Yeah. But so I can't speak on the difference. I personally have not prescribed any oral GLP-1 sending my patients and even myself using injections. But I just think anything that you do oral versus injection is just going to just, work at a faster rate.
Mm-hmm. Oh my gosh. So, Marisa, I'm so glad you made it. So,
Welcome,
I'm gonna pause
Marisa.
here. I'm gonna pause here for a minute, just to introduce you to Marisa. Marisa is a nurse practitioner. She is also a brand partner at EllieMD, and she is such a sweetheart because she had to see a patient at the last minute and wasn't sure if she could hop on, and here she is. So, would you mind, Marisa, just sharing a little bit about your aesthetic clinic? And I know you had a lot of people on GLP-1s and peptides before, and then you kind of found Ellie. If you wouldn't mind sharing that, I think that would be amazing.
I'm so sorry for jumping in just now, but
Oh, I
literally,
love that you're here.
I own my own practice. I'm also a trainer for a laser company. So, like, when I'm open for my med spa, I kind of get packed and get a lot of clients coming in last minute. So, anyway, um, hi everyone. Marisa Badanchek, nurse practitioner, NP 16 years, nurse 21. Um, I've owned my own med spa for the past, goodness, 5 years. Been doing weight loss for the past 3 years. My med spa is Forever Young Aesthetics. I'm in Birmingham, Michigan. Um, I ended up, because I trained so much, I ended up learning about weight loss meds and I did the whole compound pharmacy, doing it out of my office. Big Pharma came around and started changing the law and legalities, and I didn't want to be one of those small med spas that they ended up taking my house from me and my med spa, that I saw some of my friends that things were happening with them. So I decided to start networking and sending my patients. Well, actually, I started sending my patients out to anywhere else because I was starting to get too scared. I found LEMD. Wish it was a year prior, but still found them about 3, 4 months ago. Tried it out myself. Tried it out on my mom, who's 82. Hope no one, she doesn't listen to this because she doesn't tell everybody. But she, loved I because I don't trust every compound pharmacy. I've learned from sending my clients to different places that not every compound pharmacy is trustworthy. So when I started seeing results myself again, because yes, I try everything before I prescribe it or offer it to my patients or clients. And my mom never knew I changed anything. And she was like, "Oh, this is great." I'd always ask her little questions. And she never noticed she always was like, "Oh, no, it's working." She's on GLP-1 GIP for her A1C. But I ended up just really enjoying um, how great the compound medication actually worked. And now I'm 4, 5 months in with my clients, and everyone's been really happy. I'm really excited about how the medical intake forms are taken. The doctors really listen to what my clients are saying, and I also always refer to stating, like, I refer and give them little notes to tell the medical um I don't know, the medical for the medical intake. And the doctors have been great. They've granted everybody whatever dosage I was giving them, and they granted it. So it's been really an easy transition, and my clients are still losing weight, which is making me happy because some of my clients that went with other places, they were gaining weight, which scared me. So,
Mhm. And then, hey, do you have anything? Just, I know you just got done doing a microneedling.
sorry.
A lot of no, it's amazing. A lot of the med spas that I'm working with
Mhm.
that offer peptides, it has been amazing at how it has opened up things, other aesthetics, anyways, aesthetic services, because now these patients are starting to feel more confident. They lost a little bit of weight. Maybe they want some skin tightening. Maybe they're like, hey, I've never thought of getting Botox before. I want to get that done. And so I just was wondering if you've experienced that at all.
Oh, 100%. I mean, I started off with my med spa as a neuromodulator, right? Giving Botox, Juvo, any type of toxin. And then I am a laser girl, so I do have microneedling with RF. So when my clients are like, "Oh, I'm getting a little saggy," and I always have a modality that will help. So I've seen, different types of services that I can then integrate. Changing my memberships. You just have to be on the ball and keep changing your services a little bit to help adapt to what's going on.
Yeah. Well, I'm so thankful you were able to join. Thank you so much for
No
doing that.
problem.
I was not expecting you to be able to get on, so I really, really appreciate it. I wanted everybody to be able to hear from a prescriber, right? Who, could
Oh,
technically prescribe these herself if she wanted to, but this is just a nice way to be able to not lose her patients that she was having to send out elsewhere and be able to have a solution for them.
yes. And also, it's made my life, because I'm a solo provider, it's made it easier for me because I had a hard time continuously ordering
Right.
and prescribing the meds. It was very difficult. And I always wanted to get into peptides. I was too scared to because there's always that fine line with medicine and with the FDA and everything. Whereas LEMD, I trust their compound pharmacy. So now I have no problem referring my clients. Yes, I do guide, I handhold a lot, but that's why my clients come to me. But I educate. And I do think that this is huge. It's a medication still. So we need to continue to educate, not
Hmm.
just sell.
Yeah.
And I that's why I really like LEMD and their compound pharmacy because it works and it's safer than the others that I've seen,
And
honestly.
Marisa has also been a spotlight provider on the webinars that we talked about. So, your first couple of weeks, I think you got on and did the spotlight, invited a bunch of your patients,
I
and
I
that
did.
was,
I look like a hot mess, but yes, I did.
but you
Marissa,
did
I
great.
want, Lori, it's okay if
Yeah.
Marissa, if you can just talk on or touch on that whole liability and for my providers, mostly my nurse practitioners here,
Yeah.
are really trying to take off their clinician hat, which
Hmm.
Lori will tell you. When we did that first call, I was like, Lori, I don't know what you're talking about. I am responsible for my patients. You cannot tell me I'm not liable. But now I get it and I figure it out. So if you can help everyone understand that part of LEMD.
So because I'm a solo provider, I still have the hand holding, right? So yes, I still have that extra consent that you can figure out how to write and we can help you write it because I use ChatGPT, I'm not gonna lie. Um, but it just kind of states I guided my patient. So what I do is it's a third party. So my patient comes in, talks to me. It's a new patient consult. They sign all my consents that I usually do. And then I just educate them because I'm a provider. After that, I help them. I was like, all right, scan my code. Please, add on or make your little account, make your account. And then I guide them. But I'm a medical professional. I can guide anybody, but it's still, they're purchasing and doing everything through LEMD. So they're the third party. The doctor is fully through LEMD going to give you the yes or no answer. And I'm not personally telling the patient or client what to say in their medical intake.
Yeah.
You guide them,
Right.
but if they're trying to do weight loss and their BMI is 19, you shouldn't be guiding them to do weight loss at a BMI of 19. So they can, you have to be honest. You're still a medical provider. I still do write a consent or have them sign a consent saying that I'm guiding them. And then it's not kind of on me, but it's a third party that you then send it. They pay through LEMD. That doctor decides if they want to give them which medication. Because I've had clients also try to get GLP-1 GIP, and they said, no, I'm sorry, you're going to go to just a GLP-1. And that was that doctor's rationalization by how they wrote their medical intake. I had no control over it. So that's it. I do handhold a little bit.
Yeah.
I do have them come back in. I'm not gonna lie. In like a week or whenever they get their meds, and I help them draw them up. But that's me. Um, and that's because I want them to keep coming in my door. And I offer vitamin injectables. I offer other services. I teach them other things. I have the protein packets sitting on my shelf and teach them that way so I can actually sell it off the shelf. So there's other options you can do.
Right.
Yeah.
I think for everyone is that's thinking like I was thinking and like how Marissa was thinking, you have to think of this as like again, my prescribers, my licensed clinicians, you have to think of this as like you're referring, just like you would refer a patient
Oh, yeah.
to a cardiologist for uncontrolled hypertension. You would refer to, any other specialty. You're referring to the peptide specialist. And those peptide specialists happen to be LEMD. That's
Yeah, that's a
have
great
to
way to
think,
put it.
yeah.
Yeah.
That's how you have to think about this. Is that yes, that might be, or you might refer a friend. It's not even your patient. You could be referring a friend. Hey, I went to this office. I'm going to send you there because they helped me a lot. Same thing. Here's this link. There's peptides for all types of things. Somebody dealing with, fatigue, chronic pain, inflammation, whatever the case is. You're just giving them a referral, a recommendation. I'm recommending this. This is where you'll go. Look through the peptides, see which one you think works for you. And the LEMD providers will review your medical history, your request, and go from there. So everybody has to think of it as like a referral or
Yeah, that's a good way to put it.
recommendation.
I
Mhm.
like that.
Yeah.
I'm going to say one more thing because I saw a question just pop up. My clients, when they sign up in front of me, they get a text message literally within 30 minutes. I want to say maybe 10 to log back into their LEMD. And it's usually their physician saying they were approved, or if the physician has any questions. That's rare, depending on how they did their medical intake. But then they ended up, they received their medications. It was like, how long does it take for them to receive their peptides? Um, I've had clients say within the next day, and it's not everyone. I just can't figure out exactly. It depends when the pharmacy gets like overbooked, too busy, but it's usually within a, a day it's happened to about 5 days. And
Mhm.
they ship it overnight and shipping is free.
Mhm. Yep. Yep. Couple other questions. There's some questions about hormones in here. Do they offer hormone therapy? Rumor has it they are going to be offering hormones at some point this year. I'm not sure when.
I've heard that.
So the one thing that I would say, because again, some of you offer hormones and you enjoy doing hormones, in that case, if you just wanted to offer the peptides only on your website, for example, again, you could actually have your website only show the specific peptides directly that you want to be able to offer through Ellie. So don't feel like if they do add hormones and you don't want to offer them, you don't have to. But certainly there's other people that are like, hey, that's really exciting that they'll be able to do that in the future. So that is one of the things that they are absolutely talking about. Somebody was asking about commissions on your own order. So you don't get a commission. You do make a commission on your own order. You get paid on your own order the next week. So it's not like when you're a brand partner, you log in that your commission or that your discount is like applied to your order. You place your order just like everybody else, and then you actually get your rebate on that the following week. Let's see if there's any other
I
one.
saw shipping is free. It's
Hmm.
all included.
Yep. Yeah, there's no memberships. There's no like they get unlimited doctor visits. Let's see.
Lori, there's some questions in the Q&A.
Oh,
Again, a lot of the medical legal liabilities. So someone's asking, what is the medical legal liability in regards to if someone has a negative outcome?
so it's still on the prescriber, which is the LEMD doctor. That's where the liability is. And if the patient, let's say they were having a side effect, what you want to do is you want to have them message the provider through the portal. Not that you can't help them, but at the end of the day, it's the prescriber that's responsible for any issues that may happen with it. Again, I think because, especially with the GLPs, they customize the dose based on the patient's BMI, which really helps minimize the side effects. If they're brand new to GLPs, they're going to start them on the lowest dose and then they kind of titrate them up. And then, like Marisa said, if you have a patient that's already on a GLP, they can just upload the existing prescription that they have, and LEMD will start them at that dose. They don't have to start all over again. So that's another nice thing. They can use HSA and FSA. So, yes, they do accept HSA and FSA. Let's see what else is in here. And we'll
They,
send a replay of this out for everybody
they,
as well.
you have to pay for, they give you a 3-month shipment. I don't know if this was answered. Um, but they send out a 3-month shipment. You have the option to pay monthly, but they request a 3-month payment. I just saw, do you pay it 1 month at a time?
Yeah, so they can pay monthly, but they get all 3 months up front for GLPs. So the GLPs are a 3-month program, like the BPC 157. I know because I'm doing that one is an 8 week to heal my shoulder kind of thing. I'm not going to be on that forever. So for the GLP specifically, they ship you all 3 months at once, but you can pay for all 3 months at once, or you can pay monthly. So I think
And
there's a small fee if you decide to pay monthly.
yeah, like
It's
$15.
yeah.
So Jessica, do you just charge a consultation fee? How do you get paid for your service? For my reoccurring clients, I do not charge them because they do other services with me anyways. But for my new clients, I do charge a fee. That's up to you what you would want to charge. Um, I truly also add in, and I always, every time my clients come in, I give them a vitamin injectable, so they're paying me for that. Again, my clients are like family, so I'm getting commission on the side of it. So it kind of all works out in the end. It's just not right then and there when they see me.
Yeah. And then Dr. Grace asked just how much do you get paid? So it's a 20 to 40% commission depending on your volume. You start at 20% and then it goes up to 40%, actually relatively quickly. I think when you have about 10 to 15 clients, you're in that 40%
Yeah.
range. So it just depends on your volume. But even at 20%, I can tell you it's still pretty good, especially because so many of these patients reorder. It's like they get such good results, they want to stay on them, or maybe they titrate down to do microdosing.
Lori, I'm going to jump in with a question for you. Ari said, I'm so interested in adding this to my mental health practice. Do you help or give marketing tips to brand partners?
Yes, yes, that's what I love to do, actually. That's my bread and butter of what I do. So, yeah, so I have an entire webinar. Actually, Marisa is on it, and two other brand partners that are in the wellness space where they kind of share their tips. And at the end, I talk about some marketing ideas. And then, as I said, you will do a call with me specifically, and we'll kind of take a look at what are you doing currently for marketing. Do you have a website already? How big is your email list? Do you enjoy speaking? Do you not want to speak? And we can come up with a plan specifically for you. But we have a lot of these templates done. Email templates are done. Social media templates are done. You can tap into the webinars that Ellie does, as well as the team webinars that we do. So there are tons of marketing resources. And again, I work with tons of med device companies. I have not seen a med device company that has the amount of marketing resources that Ellie does. So hopefully that. So yes, we will help you. And honestly, no matter your specialty, we're here to help. I mean, it helps me to help you be successful. So of course, I'm
Exactly.
happy to help in any way that we can. All right. This was a great group. My
It
goodness.
was. I'm
So
like
many
typing
questions.
away. I'm trying to answer all the, there are so
I
many
know
questions coming
there is
in.
not a non-compete clause. I'm going through them right now.
Yeah.
Um, yeah, sorry, just keep kind of going through.
Just so everyone knows who's still on, go to click on Q&A at the bottom of your screen, click
Mhm.
on answered, and a lot of the questions we answered already are there. So your question might be the same. If we don't call it out or read it again, it's because we answered that question already.
Mhm.
We had almost 400 people registered for this webinar.
Did
So
I look good?
we're just trying to
Sorry.
get through everybody's question.
Sheila asks what is the commission when another brand partner is referred? So you get it's around 7%, I think is what it averages to be
Mhm.
7%. So if you know, like I said, your friend went to nursing school with you and they decided that they want to be able to offer this and you refer them, again, they get to tap into the resources as well. We will also help them, but you earn a 7% commission on any of the orders that come through there,
And
basically.
don't, and I know 7% sounds small, but we're talking about 7%, and that person could take this and run with it. So
Mhm.
if
Yep.
you bring someone on as a brand partner, that you could possibly just sit back and collect that 7%.
Certified menopause practitioner. Awesome. I'm also a part of the Menopause Society, so that is great. Definitely, yes, you do not want any telehealth company taking over your job with HRT. So yes, you absolutely can pick and choose what products you want you want to offer with EllieMD. So like even when I met with Dr. Chung at the beginning, right? Like she's doing a lot of the weight loss. And I'm like, hey, you know what? If what you're doing right now is not broken, like you don't have to fix it. But she didn't have access maybe to BPZ 157, TB 500, or the PT 141 or the skincare line. So you can definitely pick and choose which peptides you recommend to your patients. Absolutely. Um, Tasha, we'll get the replay to you. Do not worry. Awesome. Oh, how long is the offer for $79? As far as I know, I don't know that they're going to raise the price. They did a special in January and it was only $26 they did for 2026. So sometimes they reduce the price, but yeah, the $79, as far as I know, is here to stay. And I mean, I can't promise I'm not in charge, but it's a very low cost. And then again, it is the $8 a month recurring fee. So that's the only extra fee. Um, in the process of selling or starting a telemedicine medical weight loss clinic, how does this benefit your practice? So this is a way for you not to have to worry about how to get the peptides. They're going to be shipped directly to your patients. You can still do all of the other telemedicine things, gut health, lifestyle modifications, HRT, any of those other things that you're going to do. And LEMD is just going to actually approve and ship the medication directly to the patient. So awesome. Well, I don't want to take everybody's entire night here. This was great, you guys. Thank you so
Right.
much, Dr. Chung,
Thank you, Lori. Thank you,
for
Marissa.
putting
Yes.
together 400 and some people that were interested in this. And we're going to do these again.
Right.
Um, and we'll get the replay out to everybody as well. But definitely, look forward to working with so many of you guys and helping you to be successful alongside Dr. Chung and the rest of her team. So
Yes, thank you,
Thank you.
everyone. And we will send out the replay. We will send out the link and where you can actually look and browse as if you were a patient, as well as how to move forward with signing up as a brand partner. Once you sign up as a brand partner, Lori and I will be assisting you. Lori is amazing. So I am like under her wings, and she has taken me on, and she's going to take you on as well. So thank you, everyone. Thank you, Lori. Thank you, Marissa. And we will send out emails if you want to join again, or if you know someone, get them on so they can hear about this as well. All right. Thank you,
Awesome. Thank
everybody.
you. This was awesome.
Okay.
I had a great time.
Bye bye.
Appreciate it.
Bye.
Bye bye.